So in addition to talking about some of the specific phenomena that are associated with chronic pain, like pain catastrophizing or fear avoidance beliefs, we can also just generally talk about some of the emotional factors that are associated with chronic pain. So there's a bunch of research that shows that things like anxiety or depression symptoms can actually amplify chronic pain or even make you more likely in the moment to develop a chronic pain disorder if you are currently dealing with a bout of depression or a bout of anxiety or something like that. So that has been sort of represented the foundation of some research that suggests that maybe there's a larger emotional component to pain than we thought there was, which makes a lot of sense. When we look into sort of how people experience different emotional sensations, this is of course a very complex and multifaceted sort of experience that we have inside of ourselves, these emotional and experiential factors of it. But we can break down some consistent features of it. And one of the most interesting and maybe important for chronic pain features is the idea of your body having a sort of threat response, and that possibly driving at least these anxiety symptoms that some people have. This is particularly interesting because pain in and of itself is a threat response. If you think about it, pain is there to keep you safe. If you're experiencing some sort of pain sensation, your body's going to flinch away from something, trying to get away from whatever is hurting you. That is folded under our sort of like threat response umbrella. Consequently, people are arguing that perhaps what's happening with some of these modern pain experiences is that there's this almost sort of hyper emotional aspect to pain that isn't really being attended to, and that's one of the things that's causing these sort of chronic pain experiences to get so stuck for people. Put another way, it's sort of mimicking some of what seems almost like a post-traumatic experience, but instead of the sort of life or death situation that is the definitional aspect of a post-traumatic experience, this is sort of a post-pain or post-severe pain experience. And if you have a severe post-pain experience with a lot of emotional intensity associated with it, maybe these things are sort of getting stuck for you, like they sometimes get stuck for people who've been in life or death situations that are really terrifying, painful, and horrible. This has led to a bunch of really interesting treatments that's sort of almost the second wave of chronic pain treatment. So these were pioneered by people like Dr. Sarno in the 1960s and 70s, and some modern practitioners like Dr. Schechter, Schubiner, Dr. Lumley, Sullivan, or Dr. Sullivan. A lot of different people have been sort of moving to this new modality and recognizing that the emotional aspect of chronic pain is actually really important. And there's good evidence that shows that being able to express the emotions that you're experiencing or were experiencing around the time of the sort of injury that initially caused the acute pain that eventually became chronic pain can actually sort of reduce your overall pain experience. And this seems to apply to a wide variety of different illnesses and disorders that are associated with chronic pain. Things like fibromyalgia, lower back pain, and other pain disorders. So it's a really interesting and promising new dimension, really trying to blend in everyone's emotional experience and associate with that with their pain experience and try to treat both at the same time.